Hello, everyone, and welcome to another episode of I Am Christina DiArcangelo. And today I have my guest, Stacy McIntosh. Welcome, Stacy. Thank you so much for joining us today.
Thanks, Christina. It's really great to be joining you. It's great to see you again.
I know, I'm so excited to have you on today. So for our viewers and listeners, because we have the viewing and the listening option through the podcast, I always say that when I open it up. Stacy and I have known each other from my days back in California when I used to work out there doing clinical research. We met a long time ago out there. And I know it's dating us because we don't look like we're, that old, but that's where we came together. And I wanted to have you on my show today to catch up with where you are, because I've seen a similar path that you've been taking as well with your career that's similar to mine in certain extent. So I don't want to steal your thunder. So I'm going to turn it over to you, Stacy, to introduce yourself formally and talk about what you're doing now.
Thanks, Christina. I appreciate you having me here today. So my name is Stacy McIntosh, and I have, graduated with a bachelor's degree in environmental biology. And I started as a research assistant about 25 years ago now. And I was working for a small contract research organization, and their chief client was a branch of the National Cancer Institute. And in that capacity, I was exposed right off the line to clinical research involving a lot of nutraceuticals, dietary supplements, as well as secondary indications for products that industry sponsors were interested in furthering through government-sponsored research. It's a great foundational place for me to sort of earn my chops. And 25 years later, I have operated primarily in the role as a primary liaison with the Food and Drug Administration, trying to seek initial approval for multiple pharmaceutical and biotech products. And most recently, I'm very pleased to share that I was principal in the effort to get the Ebola therapeutic Ebanga approved just last December.
That is huge.
A year ago, December, time flies, 2020.
That is so huge. And congratulations on that. I watched that approval come up, and, trying to especially work in a virus like Ebola and get an approval is huge, is very, very huge.
And it was also, the clinical research was conducted during pandemic settings, and there was an active outbreak. And so it was actually a nice little primer for what we ultimately faced with COVID-19. And so I was able to help in that capacity too. I was the project leader for the start phase of the first in human clinical trial for the oral therapeutic molnupiravir that was picked up by Merck.
It's huge. That's just amazing. You should be so proud of yourself.
Well, thank you. I am most proud of the fact that we have products available for really important indications for underserved populations. And I find that my aspirations throughout my career have been to try and find those indications that serve unmet medical needs, orphan indications, or are, somehow devise new guidelines or alter the healthcare sort of setting. I like to have some impact. So that's where my pursuits have taken me. And lately, I find that I am more interested in furthering my clinical research, more specifically into traditional foods, food as medicine, nutraceuticals, herbal products. And I'm taking some graduate studies, hoping that one day I may aspire to be a clinical herbalist.
Oh, that's so awesome. I didn't know that. Thank you for sharing. This is one of the things I love about my show, is that I learn, exactly some of the things that you're working on as a guest that I didn't know that you were working on, because I didn't see anything come up. But I've got to say, I enjoy watching a lot of the things that you post on LinkedIn, whether it's guidance that you're sharing with everyone relative to the regulatory FDA space, or just product information or nutraceutical or positive reinforcement, because at the end of the day, we're talking about helping unmet medical needs for these patients, right? And it's not just what we're giving them to orally take or however they're consuming the product, whether it's transdermally, et cetera. I like the fact that you bring it full circle, similarly to what we do with the fact that we have the nonprofit, the advocacy firm. So I see a lot of you, a lot of your posts trying to advocate for patients so the patients know, in case they're seeing your content, that you're actually there for them and that you're one of the clinical researchers that really does care about people.
Oh, well, thank you. Yes, most certainly. I've always considered my position within industry to be in an advocate service capacity. And whether that's identifying potential clinical studies, whether that's making some of the meta-analyses that we're privy to more relatable to a lay public, as much as possible. And also, I have a real affinity for the simplest solution possible. And so if I can get the same benefit, I have a sensitive stomach myself. I am a patient. The first 6 years of my life, the medical industry thought I might be epileptic because I had two febrile seizures, fever-induced seizures. And they put me on an epileptic medicine for the first 6 years of my life that I didn't need because I'm not epileptic. And I think that destroyed my gut. Subsequently, I had a lot of anxiety and depression when I was growing up. And I later was diagnosed with IBS. I was on antidepressants and I had to wean myself off of those. And as an adult, I find myself finally, the calendar has moved, and what was a indiscernible, physicians had trouble diagnosing fibromyalgia, is now there's a test that just definitively diagnoses. So I was blessed that I was in the space where I got a definitive diagnosis of fibromyalgia. Mm-hmm. And so, my brother had bipolar disorder and a lot of depression, and my mother has had chronic illnesses. My father was a recovering alcoholic. And so, I have always had my extended family. I've always been an advocate within the family. Everyone's been a patient throughout their lives. So I've always felt very invested in trying to resolve and further direct patient benefit.
Thank you for sharing that with us, because obviously that touches home with me, as you know, with my dad dying of cancer in 2015. And that's the whole reason why I started the nonprofit, the advocacy firm, and really being his advocate. My grandfather, when I was a young kid, was sick. He had a triple bypass when I was like 6 years old, which was a really long time ago for someone to undergo a triple bypass, and had multiple things wrong with him. He had AML, hepatitis from transfusions that he got that they weren't testing, and just a lot of things and he ended up dying from CHF, congestive heart failure. So I grew up with a grandpa that was sick all the time. My other grandfather died. Mm-hmm. And my other grandfather died when I was 5 months old on my dad's side. And my grandmother on my dad's side died when I was a freshman in high school from cancer, similarly to the track that my dad ended up dying from. And my mom is bipolar, manic, schiz. I didn't find that out until I was 17, trying to graduate from high school, and she couldn't come to my graduation because of agoraphobia. I didn't know. And my brother, who just recently passed, that you know about, also, I've finally been able to talk about what was happening with him. But for 2 decades, I was waiting for that call to happen that I got on January 8th, because he also has had bipolar disease as well as schizophrenia. I found out, Stacy, at the end of his life. I had no idea that he was schizophrenic, because he kept everything under the vest and abused opiates. So his behavior, his erraticness when he was taking the opiates, I didn't know was also, part of the schiz diagnosis he had that he was hiding. But then ultimately it shot his heart out. So at my last trimester of 13, he had congestive heart failure in his early 30s. So he died at 43. He was in the hospital when he turned 43 with COVID. And that's when, the final fate. So I completely understand exactly where you're coming from and why a lot of this trauma, because it is traumatic to see your loved ones sick and not getting help, and even yourself. And I'm a patient too, right? So I know exactly, how it makes someone feel, and you've got to step up, and that's noble because not everybody wants to step up with us, Stacy. They want to talk about it, but they don't want to do anything about it.
Well, I feel like we all at some point hear a calling to contribute in the manner in which we can.
Mm-hmm.
And I have tried unsuccessfully to leave this industry for years. And my heart, it's like you said, with a major depressive disorder, there's a passion project. And I knew in some respect, I could get that football over the line.
Mm-hmm. Mm-hmm.
And so I just felt, and I felt the time where I could give a lateral pass to someone as well.
Yeah. There's, it's a different grit. And I also failed to mention my son has 6 mental health developmental disorders. So I've been formulating through our commercial company, Avum, transdermal patches. So I have been working on PTS formulations because he has PTS because we both were domestically abused by my ex-husband. Unfortunately, Christian luckily didn't have it as long, because once I realized he started doing it to Christian, then that's when it was time for him to leave. But he watched me be abused by his dad, through his early years. I mean, he was 6 years old when I finally decided I can't do this anymore, when he started going after Christian verbally and mentally also. And that was it. And so my call to action with Christian was to make sure that he is safe and that it's okay to talk about how he's feeling. It's so different than when we were kids, when we couldn't say things like this. But now we can give that blessing to our children so that they can feel comfortable to sit there and talk to us about things that don't necessarily make them feel good about themselves.
Yeah, definitely. As an adult child of an alcoholic, I've been through therapy several times. I've sought it out. Before my marriage, I didn't want to drag repeating cycles. Before we had kids, and it's chip away and chip away and chip away. And your consciousness will give you access to those points of pain to resolve when you're strong enough to take them on. Mm-hmm. And it will protect you until you are strong enough to take them on.
Mm-hmm.
And, in my own setting, I can attest that my mind walled off childhood abuse until I was an adult, and it resurfaced. And I took myself into thrice weekly counseling for 2 years.
Isn't it interesting, right? That
it's an earnest pursuit.
Right?
Finally, there's little signs, little cues, and then boom, it's like the curtain drops and the puzzle pieces all come together.
Mm-hmm. I had a similar path. I didn't even realize there was such a thing as domestic abuse for children other than hitting, right? Getting beaten. That's the only domestic abuse that in my mind that was registering, and I didn't have, the violent. I mean, there was only a couple times she tried that, but I was bigger than she was and stronger. So it's really not a good idea. I was very feisty too, So I didn't know though that about the mental stuff, right? And the verbal stuff. And then when I ended up marrying the same type of person and that ended, I got into therapy. I messed up. When my dad died, Stace, I didn't get therapy. I should have, because I was broken when he died. I had a little boy. I had a terrible marriage. My main man, my first true love, is now gone. And I wasn't ready for him to go, even though I was there on the front lines working. I was doing my job, but I wasn't
exactly
his daughter. I was CD, the professional, And so I started therapy in 19. I'm 20, actually 20. 19 was when I separated, and 20 was when I started therapy. And I still see my therapist every once in a while. I mean, I just had a death with my brother. So it was like, listen, we have some issues I need to talk about, so I know
stuff surfacing.
yeah, I know I got to go back, and that's, that's such a great testament to who we are as people, because we ask for help. Many times entrepreneurs and career corporate women don't know how to ask for help, or are embarrassed to ask for help, and they just keep it all inside.
Don't get me wrong. I'm one of those people who thinks that I can do just about anything on my own. And yet I have become much better at being willing to speak up when I'm the weak link.
Mm-hmm.
Because ultimately I want the strongest team, optimal presentation of whatever it is I'm putting into manifestation.
Mm-hmm.
Whether it's, my own expression, whether it's a work product, whether it's the time I take listening to someone and really being an active listener. And in that pursuit, I think that similar to you, I find that my best service contribution is in a capacity developing products that are intended really to benefit the patient, not necessarily the bottom line.
Mm-hmm. Yeah, that is so huge. It's so huge because, we're veterans in the biotech industry. You and I both have worked on really big blockbuster drugs, right? And we've seen the profit margins that these companies have made on the backs of our work. And there's not a lot of us that will stand up and say that, it should be over the patient's benefit over profits every day, all day. And I love the fact that you said service. That's amazing, because Stacy, not everybody talks about that what they're here to do in life, what their service is. That is so awesome that you said that, because that's something that obviously resonates with me, because that's what I do every day. My service is what? My service is what am I doing today to serve people, to serve my son and people in general, my friends. We are service-oriented people, and we're prideful in the fact that we want to help, really genuinely help people to the best of our capacity.
Yeah, absolutely. My brother has passed. He died when he was about 37. And when we were growing up, he used to say, "She makes it look so easy." And I work really, really hard. But the other thing is that I'm pretty good at manifesting.
Mm-hmm.
I'm pretty good at producing. And that's because I'm never really seeking anything for myself.
Mm-hmm. Mm-hmm.
I mostly want to see the field around me benefit and upgrade. I want to see joy.
Mm-hmm.
And because it's not for pure entitlement or personal benefit, I feel that it's a natural flow. It comes almost through me rather than from me.
Mm-hmm.
And that makes it easier. That attracts more. That makes more synchronicities happen. That makes more networking opportunities open up. It's amazing what happens when you're in that space. It's almost like playing the slot machine and just being ready to receive.
Right. Which is an awesome way to think about things, rather than trying to push a boulder up the hill, right? Yeah. Going, oh, well, if I do this, maybe this person will want to work with me, or maybe this opportunity. Oh, this guy, they got a grant. Maybe I should reach out about helping them. I do the same. Listen, I don't even answer RFPs anymore. And again, I'm not being cocky. I just know that the projects I'm supposed to work on come to me now, because I'm in a place in my life that these things come to me. And even when there were times that I was at my lowest and nobody knew it, um, you know, when I was going through all this stuff domestically, which was dreadful, I still was performing with my job. Nobody knew this was going on, and this is nonsense. That.
Well, I've done both. I had the moment where, so I married my college sweetheart, and we divorced. We were together for 19 years altogether. And I was completely flummoxed. I'm the one that elected to leave. And yeah, I was completely flummoxed. And my career stalled and spun, believe it or not. I have crashed and burned this career and brought it right back up to, career-ending achievement in my mind. So A, you're never out for the count. B, you're okay to take some time for yourself. You don't have to be perfect, right? Mm-hmm. Everybody needs a little bit of time to check out maintenance. Let's call it neurological maintenance.
Yeah, no, but it's true. It is so true. And, it's funny that you're bringing this up, because because we're getting at the end of our time here. And I want to kind of go back to our discussion wherein, and you started to kind of give it to me, but I want to do it a little more formally, is that I'd like for you to share for the audience 3 successes that you've had in the whole transformational events that have led up to who you are today as a woman leader, as well as those 3 negatives, which you already kind of tipped us off when you just said what you said, but I kind of want to bring it to that in a more focused effort, so that people have some takeaways from you today, other than what they're already listening to.
Okay. So I think you said 3 successes or
positives and 3 negatives.
Positives? Okay.
Yeah, like the battery.
So obviously I have to say that, from a career positive, I've had the consistent support of my family. So much so that, my partner, essentially, we've reversed roles. There was a time where he was primary breadwinner, and there's been a time where I was primary breadwinner. And during a time where I had to focus on taking an important Ebola therapeutic over the line during the pandemic, he was there for me, everything from putting food right under my face to keeping the house on track. So number 1 thing I have to do is give credit there. 2, early mentorship and recognition from really key leaders who believed in me. And to the extent that we as leaders in a different era can give that same confidence and beatitude to those that come after us, I'm here. 3rd, people offered me challenges I wasn't convinced I could achieve. And yet, their belief in me helped reaffirm my belief in myself.
That's awesome.
And so I've risen and been able to successfully achieve those things I didn't even think possible.
That's amazing. I love that. Thank you.
Yeah. If I had to talk about 3 negatives, I have also found myself running up against senior women in leadership positions in the biopharmaceutical industry who are feel that they must play the boys' game in order to get ahead and to survive in this industry. And I think that women bring a unique vantage point, a unique set of skills, a unique perspective. And I think that we do it differently. And I think it's more compassionate, and there's never been a more important time than now to infuse more of that into the healthcare system. And so I would implore women to be yourself. Don't try to play what you believe a successful man looks like with a skirt on.
Mm-hmm. Yeah, I hear you.
And then, one of the hardest challenges I've actually had in this industry is being my native self. And when I actually felt a little bit like from my own career, aims, I felt a little like I had finally, made that 3-pointer. I changed my hair. I changed my appearance, and I don't hide my native self anymore. And if you don't want to engage me because my hair is green at this time and blue last week, it'll be standard corporate 2 months from now. I'm in a phase and this is my full expression, and I don't feel like stepping back from my full expression anymore. There's been plenty of opportunities that have come and gone because of that. And I'm just more committed to that than ever before.
Let me tell you, when I saw your hair color, I loved it. I absolutely loved it, because I was like, look at her go. Because I have on the insides of my arms, you may have seen it in some pictures, I have tattoos. I have, and it's not like I have jailhouse tattoos or anything weird. I have DiArc, because that's my nickname because of my dad, loyalty, and the infinity symbol, and the heart with the name DiArc, with the Italian colors, because we're Italian. And then my dad's initials with the APA logo on the end, with the stars that were above me the night he died, that went away when they finally took him out of the house, and love. And do you know, I have had criticism. I had a 3/4 length shirt on, and I was interviewing for something. And it was a client that I actually wanted to work with. And one of them gave the feedback about my tattoos. What does that have to say about my job ability, my tattoos? It has nothing to do with anything that I can do. The same way about your appearance. If you want to have blue, green, pink, purple, orange, who cares? You're doing your job, you're hitting your marks, and you're making a difference. What does that have to do with how you look on the outside, when it should be what it is on the inside that drives you?
Yeah, I think, we need to recalibrate. And I think it's far more important that people are ethical and conscious and
how about that? I mean,
and I've played the game, and I feel like I've, successfully arrived in a place where I support the projects that I feel passionate about with my energy and time. It's like a vote, and I don't support anything that I can't ethically get behind or that I wouldn't take myself.
Right. I agree
and
with
I
you.
I never have been able to, but it's been a process of weeding out as you go through the industry.
Oh yeah. No pun intended. Because, the cannabis side. But I appreciate you sharing those things with us today and talking through some of the challenges you've had and some of the hits that you landed, the 3-pointers, as you said, because I think it's important that people really listen to some of those little tidbits that you gave to them today, because with who you've become, it hasn't been an easy journey. And you're still doing things to continue on your journey to hit those high marks while still, hitting some of those low things that happen to occur. You just can't help it. It happens. It's life, man. And we're still in a pandemic. So as much as we try to, so I just wanted to thank you so much for being on the show today. I really, really appreciate it. Talking to you.
It's so great to see you again. It's been so
long. It's been so long. We grew up, from where we were years ago to where we are now. And it's such an honor and a privilege to have you as my friends throughout these years. And we may not have talked every day, but I think we always knew that if you needed something or if I needed something, we could reach out to one another and we'd be there for each other. And, not to spin off your hair and say true blue friends, but really we we really are, and that's another that's an important lesson, I think, to share with people, is that women can be friends. They can deliver together, deliver separately, and to cheer each other on. That's what's most important. And
definitely.
And I love the fact that, you have that service umbrella that you sit under like I do. So thank you so much for joining me today.
Oh, thank you, Christina. Thank you for having me. And just one final concluding word, it's not just merely women supporting women, it's women with ethical, compassionate, service-oriented principles supporting the same so that we can just grow that network. So thank you for being who you are. Thank you for sharing as much as yourself as you do.
Thanks
for having your podcast.
Oh, thank you so much. So with that, we're going to end today's episode with the way we always do, wherein we say, remember, we are the same. I am Christina DiArcangelo. Thank you for joining us today.